有冇聲？好。
Do you hear me? Thank you. Members, good morning. We have a quorum. Let me call to order the meeting of the Bills Committee on Smoking Public Health Amendment Bill 2019. First, we'll invite the administration team to come in.
咁政府部門入緊嚟嘅時候呢，
While the administration team joins us, I'd like to say a few things. First, the clerk issued a letter from Dr. Pierre Chan, dated the 28th of November. For your reference, the administration said that they would give a written reply later. Secondly, at the meeting on the 25th of June, members asked for follow-up action to the points of the discussion, and also the two motions carried at that meeting. The administration has provided response papers to these. They are in CB bracket 2283/19 to 20 bracket 03 and 02. Now I'd like to invite Ms. Amy Yun, Deputy Secretary for Food and Health, to take us through those two papers, please. Thank you, Chairman. Good morning. As for the two motions carried at the meeting on the 25th of June 2019 and also the follow-up actions necessary, we have already given written replies. First of all, comparison of a full ban proposal with regulatory approach. In terms of health risks, we have said in the reply the health risks relating to e-cigarettes and HNB products, including serious diseases and also fatalities, and also the global tobacco epidemic report released in July from the WHO. And also, if we are going to use the regulatory method for tobacco, which is conventional, and apply it on e-cigarettes, we cannot include the devices and accessories for e-cigarettes. We understand that they can now collect data of the smokers, and also they can influence the smoking behavior remotely. These will allow the tobacco industry to promote intoxicating tobacco products, and it can also affect the effectiveness of our regulation of e-cigarettes. And if we are going to legislate to do regulation, we can hardly catch up with the state-of-the-art technology relating to e-cigarettes. So we don't think we should spend a lot of public resources to regulate such harmful products. So from the point of health risk, if we put a total ban on it so that we can also regulate the devices and accessories and not allow them to take root in our market, we think that would be the most effective way to do it. On population impact, if ASPs are formally introduced into the local market, it would allow a new generation of smokers to emerge, and it can affect the prevalence rate. In the United Kingdom, Canada, and US, they have all got laws to prohibit the e-cigarette sale to young people. But still, the number of the young smokers has been going up. And then in Japan, in Korea, we can see relevant HNB product sale figures. If we do not sell to minors only, we cannot stop adolescents from using such alternate smoking products or ASPs. In Hong Kong, we have one of the lowest prevalence rate, especially for young people, and I'm talking about just 1%, and 6.7% for people aged 15 to 19 and those aged 20 to 29 respectively. And if we do not put a full ban, I'm sure what we have been doing with our young people would go down the drain. As for legal and illicit trade, whether it is a total ban or just regulation, we can see illicit trade emerging, and the extent of the illicit trade can be affected by different factors, and it is not easy for us to make an accurate estimate. If we do not have a total ban, then there will be an increase in demand for such products in the entire population. And as long as there is a price difference between the true and illicit products, there would be more and more people who are willing to patronize the illicit products. We want to have a total ban so that we can suppress the demand, and so that before ASPs become popular, people are not getting in touch with it. And actually, the WHO has always said that the tobacco trade has always said that if we oppose tobacco control policies, there will be a rise in illicit trade. We must be careful in warding off such intervention into anti-smoking policies. As for tax or duty revenue, we seek to protect public health, not public revenue, when we go for regulating ASPs. We do not know what the tax revenue impact will be, because we don't know whether smokers will actually switch to ASPs from conventional tobacco. And according to our legislative proposal, we are going to ban the sale, manufacture, import, and publicity on ASPs. We are not going to impose overly strict regulation on the person's life. So we are not going to ban the possession of ASPs for self-use. From an enforcement point of view, if we were to go into people's premises to search other people, we expect some difficulty. We believe that after the bill is passed, the average citizen will find it difficult to get in touch with such products, and I believe the Customs and Excise will be enforcing the law. Many people who object to a total ban has mentioned that the FDA of the US has made a decision to allow one non-burning tobacco product, saying that it is less harmful than conventional tobacco. And some members have asked the administration to separate e-cigarettes from H&B products. In our written reply, we have provided the IQOS sale issue, which is from an FDA report, and we have also provided our response. Even if IQOS is allowed by FDA in the US, it is also saying that even with the permission, it doesn't mean that the product is censured by FDA or that it is safe. Considering the different legal systems applying to tobacco in the US and Hong Kong, we don't think we can just copy the US example. And we also want to point out that actually the IQOS, the US has not joined the WHO Convention on the Use of Tobacco, so therefore they are applying different regulations on tobacco. As for the two motions passed at the last meeting saying that we should do more public consultation, actually in February, when before the bill was submitted to LegCo, in fact, over the years, we have been receiving thousands of deputations from interested organizations, individuals, and other people and stakeholders. We have considered all the submissions and comments. After considering the relevant submissions, evidence, and also the WHO comments, we believe we should have a full ban of ASPs so they will not become popular in Hong Kong, and so that our work all these years will not go down the drain. In pushing through our legislative amendment proposals, we have been explaining ourselves in the community to allow the public to understand the evils and harmful effects of ASPs. the DFH has made use of APIs, the social media, and also by cooperating with NGOs, the DFH has clarified the public's misunderstandings of ASPs and also to remind them of the evils of such ASPs. The Hong Kong Council on Smoking and Health also publicizes the harmful effects of tobacco. I'd just like to say again that we know that these new ASPs are harmful to health and they also emit secondary smoke. I hope you will understand the justification for a full ban and that our consideration is primary about public health. We urge for your support. Thank you, DS. The DS has taken us through those two papers. I'll now allow a discussion by members. Members can now ask questions on the policy issues. There are 6 members, and the order is Ma Fung Kwok, Jimmy Ng, Siu Ka Fai, Tommy Zhang, Pierre Chan, Yu Si Wing, and Leung Yu Chung. Sorry, speaker not coming through. The 5th one is Ray Chan. 5 minutes each, including a reply. Ma Fung Kwok. Thank you, Chair.
Well, from the paper and from the introduction given by the DS, to me, it still doesn't allay any of our concerns. For example, on a full ban, and there is really no full comprehensive reason for a total ban of ASPs. Well, there is a difference between heat-not-burn products and actually e-cigarettes, because as you see from the report, that emits different chemicals, and a full ban on e-cigarettes, I understand. However, why do you have to also impose a full ban on ASPs? Well, you talked about the trade and the illicit trade. We are actually creating a gray area, since you're banning it on one hand, yet allowing legal trade of ASPs. That means that you allow people to use ASPs, yet you impose a full ban. Oh, I understand that you don't accept e-cigarettes. Well, even if you are accurate on the associated risks, we do not see a lot of scientific evidence to support it. Therefore, to the layman, less exposure would mean less risk. So how can you tell people that you are going to impose a full ban? Perhaps you could first address these questions. DS, please. Thank you, Chairman. Thank you, Mr. Ma, for your questions. We actually look back into the 1987 Smokeless Tobacco Products Prohibition Regulations. At that time, we already prohibit manufacturing and import of smokeless tobacco products. And so there wasn't a huge trend in smokeless tobacco products at that time. We also hope to adopt the same policy, because this product is also new. It is not really being sold in Hong Kong through legal trade. When people actually do not come in contact with these products, then there would actually be a control on the demand of such products, which is the reason why we hope that with a full ban, people will find it difficult to come into contact with ASPs and will be able to better control the use of it. Now, you asked about the toxins emitted. The FDA in the United States did say that there is perhaps a less emission of certain toxic substances. We have tried to explain the toxic substances emitted is not directly related to the impact it has on human health. We see many so-called light products are promoted by tobacco manufacturers, and people would think that there is actually less toxins inside. This is actually a very good method of tobacco manufacturers to sell their products and to promote their products. We just want people to understand that it doesn't mean that there is less toxins emitted from ASPs. Therefore, we need to take a cautious approach and to handle the sale of these differently from the sale of conventional cigarettes. DS? Well, you want to put a stop to the use of these products before people or before it becomes popular. Well, actually, smokers gather together. How can you really explain that this strategy will work? Let's say you're not banning all H&Bs. Can you perhaps set a standard of the toxins emitted from H&Bs? Would that be a better strategy? All right, DS, many people are using those products, but you say that there is still no legal trade. So how can you address Mr. Ma's concern? It has been some time already. We hope to try to pass this bill as soon as possible before it becomes too late. For H&Bs, perhaps I can defer to Dr. Fong. Well, Mr. Ma talked about less toxins in H&Bs. I want to emphasize that we see there's unknown toxic substances. Yes, there is less in the H&Bs, but then we do not know what other substances there are. We do not have the data available to understand all the toxic substances in the H&Bs. When we do not know what kind of toxins are there, then it is really difficult for us to set a standard. Therefore, it will be difficult for us to try to set a standard on the level of toxins. We only see nicotine and tar in conventional cigarettes. For new alternative smoking products, we do not know exactly what kind of toxins are in there. Therefore, it will be difficult for us to set a standard and to understand the full impact. Mr. Nguyenka, thank you. Well, you cannot just pass a bill without understanding the toxins in the products. You are only making a wild guess that there are toxic substances. But actually, my question is not here. This time in CB bracket 22A3 1920 bracket 02, you said there is actually, you do not have the approval of the authorization of the FDA to translate the full report of the FDA. You are just providing a summary, but then I think that you are taking words out of context. You wrote that it is actually in accordance with the principle and that you have looked appropriate for the protection of the public health. Taking into the account of the population of the whole. So you didn't mention this at all. So you're actually lying to the public. Well, did you actually get the authorization from the FDA that your summary is totally accurate? I request you to make a accurate translation of the report of the FDA. Now, going on to my question on CB bracket 2 1175 bracket 03, you said that the government has now seen more and more evidence that there are actually negative impact on people, and then in Annex A it said that you can see that young people are actually attracted by the campaigns and promotions of heat not burn products. Well, recently the FDA is after exploring all the data, proved that there are a few toxic substances in HNBs, which has a lower level of toxins than conventional cigarettes, and then it can actually be appropriate for the management of public health. And it has already been approved in April, and it started its legal trade in October. The paper also stated that there are only a very few number of non-smokers, including young smokers who were attracted by HNBs and would start smoking. So does the administration know of these arrangements by the FDA? The administration has been drawing reference from the A by saying that this is a reason for the full ban. So now, would you actually change the full ban of HNBs into only a regulation of HNBs? DS. There are many professional and technical jargon in the FDA report, and it doesn't mean that a translation of the report will help us better understand the report. And there is actually a problem when we work on the translation, because you might query whether we have given a full, direct, and accurate translation. And it would be difficult for us to prove that the FDA has authorized such a translation. We have already provided a summary on the report. Well, in your interpretation of the appropriation of public health, perhaps I could ask Dr. Feng to further elaborate. You asked us whether she set a standard for the IQOS tobacco heating system, since it said that it is appropriate for the public health. We are using the information paper on the United States Food Administration report. And in Appendix 6 of the paper, we have already stated the detailed standards. So if you look at the paper, you would see that it talks about whether there would be a higher level of toxins exposed to the users. And in the paper, we have also listed out the same. And on young people usage, the FDA actually found that the uptake by youth was low. And in our paper, in our information paper, in paragraph 15, we see that the FDA has given its view on this usage. So they looked into two numbers in their survey, but we do not agree with those numbers. Therefore, in our paper, we have also given an explanation on why we do not agree with the papers. We only see limited data at this moment. The latest numbers actually bring a larger sample number, and we see in the study in Korea that there have been a 20% increase in youth takers. You question the toxic substances in HNBs. However, in the FDA paper and in the report given by the WHO in 2019, we are not banning this because of the toxic substances, which we are not sure about. We know for sure that within the HNBs, there are many toxic substances that we are not sure about, and therefore we should not take the risk to say that there is a lower level of toxins. I'm sorry, the speaker is off mic. Scientifically, we see that the toxins emitted from HNBs are not something we understand, and therefore we believe that a full ban will be safer.
Thank you. Control panel colleagues, please boost the volume of Dr. Feng's microphone. Mr. Shu Ka-fai. Thank you. Just now the doctor said that they do not know the toxicity of some substances in HNB products. Can you let us know what those substances are? With regard to the FDA's report, please speak up. Please speak into the mic. Para 4. Point 2 in the appendix. This is within the FDA report. After vetting the product, it would say that the aerosols contain some chemicals which are different from those found in conventional cigarettes. Some of the chemicals are genotoxic or cytotoxic. But then please read on. It says these chemicals are present in very low levels. Well, you were asking me for the substances. Well, yes. It says, although some of the chemicals are genotoxic or cytotoxic, these chemicals are present in very low levels. Why do you only read half of the sentence? You only read out those that agree with you. The members of the public can't see the paper, but we can see the paper. What are those substances? There are dozens of substances in HNB products, and these are unique to HNBs, or the levels of such substances are higher in HNB products, and this is mentioned in FDA. Since these are chemicals, it doesn't make a lot of sense for us to list them out here. Well, Chairman, well, there are many elements and chemicals flying about in the world, and you are inhaling these chemicals. You are wearing a mask just because you want to inhale less. Everybody is inhaling these substances. You have to let me know how much we can inhale and stay healthy. You must quantify it. You cannot be so vague. You're so vague. Chairman, the AVIC Bureau is promoting a full ban. Well, it looks like you have a very successful strategy, but I can tell you, your way of doing it is ridiculous. E-cigarettes and HNB products are totally different things. Together with medical and educational organizations, they have been saying that children at 12 years old are using it. Well, they are talking about e-cigarettes, not HNB products. HNB products are more expensive than conventional tobacco. And you have told us that the smoking rate amongst young children is as low as 1% because it is too expensive for them. In the US, people are dying from vaping, but they are talking about e-cigarettes, not HNB products. There is a big problem with vaping because liquids have been mixed into the e-cigarettes and we don't know what those liquids are. Well, I haven't seen anybody supporting e-cigarettes here, but I'm talking about HNB products with you. You should not bundle the two together. It's just like the first day people smashed glass at Lechco. Those were only the people at the front. Those behind them were protesters. You can't say everybody is a rioter. If you called everybody a rioter, of course people would riot. You shouldn't be mixing the two together. You shouldn't bundle them together. I don't know how much confidence you have as a government that your indicators are better than the US ones. Mr. Jimmy Ng already pointed out to you that there is a comment on this product that it is appropriate for protection of public health. But I can't see how you have quoted this in your report for the sake of members here and the public. You have a totally different conclusion from the FDA report. You also said, well, in your paper, you say that actually it should be in your paper. 283 bracket 02. What does this paper say? You say even if you use the FDA report, well, it is not a member of the WHO Framework Convention on Tobacco Control. Well, it looks like you are quoting someone authoritative, but I'd like to point out to you that amongst the countries of WHO Framework Convention on Tobacco Control, US is not a member, but it includes Korea, Japan, Canada, those developed countries. These are in some of the members, and these members actually are telling directly that they support HNB products. Why don't you say so? Why don't you tell us that? Explain that to us. If, well, you should become a barrister at court because you are economical with the truth, but you're a government. The Bureau, any response? Well, we emphasize that the U.S. is not a member of the WHO Framework Convention on Tobacco Control. I think we are responding to the point made by members that we do not follow the U.S. It is because it is not a member of the convention. Now, of course, many international organizations set standards and how countries and places go about their own business. They can make their own decision. Well, it is true that many member countries allow HNB products, but then the situation may be different. Maybe they have a higher prevalence rate and they control smoking differently. And in fact, they are now also worried. They allow HNB products to be used by young people, but then in the age cohort of 12 to 18, the percentage is 2.8%. That is after they have introduced HNB products. And they saw the prevalence rate of only 1% for e-cigarettes. Therefore, it's very difficult for us to simply say e-cigarettes and HNB products are different. And we are going to impose a total ban on both, but then we go for different justifications. Mr. Shiu, sorry, no follow-up. You have exceeded your time. Please wait for your second round. Well, you allow me to give a brief response. Please be very quick. Well, you can become a barrister, but you can also become a council member because you are beating about the bush. I was asking a very simple question, and that is why you do not follow FDA, and you tell me it is not a member of the convention, so you don't regard it. And as for members of the convention, actually many members allow H&B products to be sold, but you do not mention that in the paper. And then suddenly you go for the preference rate amongst young people. I'd like to ask you about Japan. What is the rate of Japanese youngsters using conventional tobacco? Don't beat about the bush. I have been paying full attention to you. You don't have it. You don't even have an answer. Of course, I will try to get to the bottom. Well, I have to be fair to other members. Mr. Tommy Zhang, I think he is very fair to me. Mr. Zhang, you find it all right? My party colleague, of course, was quite irritated because after all, he's young. My question for you is, Amy, very simply, those who are in this room and others in the council, when we scrutinize this bill, well, Chairman, I'm going to propose a CSA, which I will submit next time at the meeting. Well, I don't think anyone wants to quibble with your proposed ban on e-cigarettes, but unfortunately, as Mr. Shiu Ka-fai said, I don't know how you made your decision. I, in the catering industry, may not match your wisdom in making such a decision. But no matter what, this is the decision you made. But then within a year, you have been lumping e-cigarettes with H&B products. You may be describing the harmful effects of e-cigarettes, but you put the two together. In 2003, I don't know what rank you were at. And then in 04, 05, we talked about banning smoking at workplaces. We sent a team to Thailand, Norway, and Ireland to study other people's example. When I saw those officials in those countries, well, at that time our prevalence rate was 16%. And the officials said, if we had 16%, we would not be doing anything. We would just be too happy. It would be disturbing to the people, and it costs money. So, just like to pick up a point made by Mr. Shiu. You know, I have all the time in the world. I have nothing else to do apart from waiting to be dismissed. Number one, as I said, no people objected to your ban on e-cigarettes. So what do you want? You are leading us up the garden path. You are irritating members, and they are suffering from high blood pressure. I don't think you can pass the bill in this legislative term. I'm asking you to go back to ask your colleagues what they want. Don't say we are filibustering. No one is filibustering. But if this is the way you're answering questions, we will all be asking you questions until the very end of the term before we can do clause-by-clause examination. So I'm advising you, if you want to catch one bird because it would be better than two in the bush, well, you should amend your act. Otherwise, you would lose the bird that is already in the pocket. So I would advise you not to try to meddle through anymore. You must be pragmatic so we can have a discussion. Just now, you said that the preference rate for young children is 1%. So I think you have done a great job. And of course, our parents had done a good job. I have a different view from Mr. Shield. He thought that it was expensive, so young people didn't go for it. But I believe it is the good work of our schools and parents. You do not ban conventional tobacco, so why so few people take it? If you go around the world and you get the figures for Mr. Shield, even the convention countries, don't look at the US. Okay, dismiss the US if you don't like it, but go for the convention countries. Look at the young people in those countries and how many of them smoke when they're under 18. You say, and now you're telling me that you are worried that young people would go for H&B products. I think you are over worried. You were quoting from 1987, 1988, and the ban on chewing tobacco. Nobody wanted it in Hong Kong, but the US people were chewing the tobacco until the juice came out and then the teeth all turned black, not yellow, but black. And then you say that was not an important law and no one objected to it. It is because no one liked it in Hong Kong. So we allowed you to go through with it. But you wrote your paper here, and then you are telling us there are over 100. Do you know how to do your regulation? Is it because the people who use it is very few in number, so you want to ban it already like chewing tobacco? Or is it that you don't know how to do it, so you just want to go for a ban because you can't regulate it?
咪揾人去識嘅。
When you don't know what to do, then you go find someone who does. I don't need her to answer. I don't want her to keep on beating around the bush. I will just wait to ask a second round of questions. I get really frustrated when she dances around in circles. Thank you. Mr. Ray Chen. Thank you, Chairman. At the last meeting on June 25th, I moved two motions. One is to request the government to suspend the legislative amendment exercise, and the other one is to try to think of more employing different means to regulate electronic cigarettes and other HNB products. I was very happy to see these motions passed. The administration tried to respond to our motions, yet I'm not very happy with the response. The administration wants to push forward the passing of this bill as soon as possible, but now we are already at December 2nd. So why is it now in December that we only commence with the first meeting of this year? Did you consult us? What is the reason for delaying this first meeting if you're in such urgency? And what will be the pace of our meeting in the future? Are we holding a monthly meeting, or is it going to be more frequent because the administration wants to pass the bill as soon as possible? It's really up to you, because for some urgent bills, we sometimes hold meetings twice or three times a month. Chairman, you really need to tell us what the pace will be in the future. Many bills and even some bills that have been passed have not been resumed in second reading. We don't even know when the National Anthem bill will resume its second reading. I thought the administration will become wiser. My motion last time moved was very mild, because I copied Carrie Lam to use the same word to request the government to suspend the legislative amendment exercise. And so the anti-extradition bill has already been suspended and now formally withdrawn. Therefore, today I will also follow Carrie Lam and to move another motion today. Well, in the past, with enough votes, the government will just try to push for a pass in the bill. But this time, I really don't know whether you would see enough votes. Well, I move these motions to help you count your votes. I don't know whether you have counted your votes or you think that you have adequate votes. That there has not been a member so far to support the passing of this amendment bill. So now we now have a new consultation. So what have you done? You said you've been trying to explain it to the public. This is a kind of campaigning. It's not a sort of exchange of ideas. You haven't really tried to understood the responses of the public. In the past, we have seen the withdrawal of items at the FC, all the items in relation to university funding have been shelved. We are very concerned about this bill too. Well, I think it's more appropriate if we really suspend this exercise and then to wait for more explanations. I was very frustrated right now when I heard you answer on the HNB products. You said you're not sure of the toxins and therefore you won't impose a full ban. Well, how about for tear gas bombs? Do you know the toxins inside the tear gas bombs? Well, if you want to safeguard the public and don't want to use a product that you do not understand the level of toxins, then you shouldn't use tear gas bombs because you don't know what's inside. That's what you told us. Well, you say that if we do not impose a full ban, then we are just going to have a very high number of new smokers, and it would spoil what you have done for the past few years. What do you mean by that? DS. Thank you, Chairman. Thank you, Mr. Chen. The smoking prevalence in Hong Kong right now is around 10%, and we have tried our best in all these years to try to control the use of tobacco. I understand that e-cigarettes came out earlier than HNB products, therefore we possess more data. I think you have to look into the Canada example that there's a actually increase in prevalence in the use of HNB products in youth, and also for the increase of the prevalence in conventional cigarettes. We have also looked into the numbers in Japan. There are now more people in Japan using HNB products, and actually the increase in percentage is actually higher than the total population increase. In Korea, before e-cigarettes was only used by around 1% of those between 12 to 18, but then within a year of the use of HNB products, there has been a huge rise in the numbers. We want to emphasize all along that the smoking prevalence in Hong Kong is low, and therefore we are concerned that young people may pick up this habit. We understand that parents may also worry about it, that if these products are sold legally in Hong Kong, then it will affect our low smoking prevalence. We're not just trying to make haste decisions. We see that there are now many new methods. Some HNB products can provide information such as to remind them when to take the product, and they might use this information in different manners. We see that there are there is nicotine in H&B products, and people might very well get addicted. Just like conventional cigarettes, it's just that they use a different device and therefore the toxicity may differ. People think that the risk is not high, yet it will still emit second-hand smoke or toxins. This is the reason why we propose a full ban on H&B products. And as to why we only resumed our meeting in December, we have wanted to hold a meeting earlier, but then we were busy with searching for more data and in preparing the information papers. We hope that the bill will be passed as soon as possible, but we do want to work with members on this decision. Thank you. Mr. Yu Si-wing. Thank you, Chairman. Well, we're looking into formulating legislation. Therefore, we need to understand the concepts clearly. We have seen confusing information in the paper provided by the government. I don't smoke. I really don't understand these products. And it was later after looking into this paper that I understand that there's a huge difference between e-cigarettes and H&B products. I do not have too much objection in banning e-cigarettes, yet I do have a concern about H&B products. I personally is looking at this from a public perspective. The government must have very clear data and clear reasons to support your ban on H&B products. However, from the paper, I see that although there are toxins emitted, it doesn't show that there may be higher concentrations, and even the reports used as examples here do not show very strong evidence. However, since we're looking into legislation, we need to have very strong evidence and data to support the legislation. You said that in Korea, there has been a higher smoking prevalence with H&B products. Well, can H&B products actually help people to rely less on conventional cigarettes? You should look at it from both sides and not only look at it from one perspective. Or can it actually emit less toxins into the air? We need more data to help us make a better decision. In the last meeting, I also raised the same question. How can the government actually inspect products brought in by travelers once the legislation is passed? I see from the paper in paragraph 10 that in order to ensure that there would not be parallel imports, the Customs and Excise Department will work together with other countries to exchange information. I remember the secretary in the last meeting said something about considering travelers. Once the legislation is passed, if travelers bring the products in, do you allow them to bring it in? Well, they might have been using this product for quite a long period of time, and then if you do not allow them to bring it in, then what can you do? We see data from certain countries. Can we also work on data collecting in Hong Kong? We see H&B products being sold in the market in Hong Kong. Has there been a higher prevalence in youth using H&B products recently? we need to collect data to see whether this really has an impact on adolescents. Let's say the numbers remain the same. If that's the case, it would mean that HNB products do not have a huge impact on Hong Kong as a whole. DS, please. Thank you, Chairman. Thank you, Mr. Yu. The paper mentioned the control and management of products for import. So there would be a stricter control on the import of these products. But then we would adopt a more lenient approach in the beginning when travelers bring in HNB products, as they do not know about the ban. They could choose to give up the products voluntarily. But we would adopt a lenient approach in the beginning. Once legislation is passed, of course, we must also promote this and let other people know so that people will not unknowingly bring in these products. HNB products also bring along a nicotine addiction. Therefore, we need to be very careful about that. HNB products are actually quite new. The last time when we conducted a study, there were not a huge number of users, and therefore we didn't pay too much attention to it. But in recent years, we see that the prevalence has increased dramatically overseas, and we worry that if we wait longer, then it will be too late for us.
As for information on HNB, I'd like to defer to Dr. Feng if there is time. Let me supplement. From the evidence we have, we can see that HNB is a tobacco product. And studies show that some of its toxic substances are found in conventional tobacco, but we have found recently that toxic substances not found in conventional tobacco are found in HNB products. And then for some of the toxic substances that are found in both, the levels are higher in HNB products. And according to WHO, even for non-toxic substances found, well, the levels may be lower than those in conventional tobacco, but then the death risk is not necessarily lower because there is not a direct proportion between death risk and the level of the toxic substance. And for now, we don't have data to show that health risk posed by HNB products is lower than that posed by conventional tobacco. This is the scientific evidence. Also, tobacco companies are publicizing the lower level of toxic substances in HNB products. This is what the companies have been doing. They claim to produce low tar, low nicotine products, leading the public to think that these products are less harmful. And this reduces the desire of smokers to quit. Therefore, the new products may prove to be attractive to young people, and there is the worry that those people who should quit may now think that there is a safe alternative, so their desire to quit smoking may be reduced. These so-called not so harmful products, which claim to be of low tar, low nicotine, well, they have not been helping to lower the total fatality rate in the population. Well, this is what I can say about HNB products. Mr. Leung Yiu-chung. Thank you, Chair. You don't ban the use, but the sale. I think many people will find that not acceptable. And the consequence will be that the black market will become rampant. And the situation will just become worse. As you know, with conventional tobacco, if the price is high, the black market will become more active. What is worse is that there will be unknown substances mixed with the tobacco, making it even more harmful and more difficult to control. This is what we have seen. But you continue to apply this principle that you do not ban the use but only the sale. And I believe there will be a lot of harm done, and you will not be able to achieve your policy objective. On the other hand, you say that before these products become widely popular, you want to ban them at an early stage. But I can tell you, they are already quite popular. At the last hearing, many came to say that their family members or relatives who used to use conventional tobacco have switched to these products. And they think that the biggest problem is if you ban it, they will go back to conventional tobacco. And it is worse for the family members because there will be more arguments, and the smoking habit will give rise to conflicts. In the paper, you said that you're aware of this. Well, it's good that you were aware of it, but you only resort to one trick, and that is publicity and education. If you had heard what people said at the hearing, you're not going to be helping them in any way. If you were successful with your publicity and education efforts, nobody would be smoking. Precisely because you are not successful, people are smoking and they are switching to new products. And still you say you rely on publicity and education, and that amounts to nothing. My question is, how can we have confidence in you that after this ban, the situation will improve? This is what I care most about. You say with the ban, people's health will not be affected. But are you going to achieve that objective? Diaz? Thank you, Chair, and Mr. Leung. You talked about the illicit trade. Well, he also said that we also allow the sale of conventional tobacco, and yet there is still illicit trade. So if you want to compare a ban and regulation, well, I think as long as there is a price difference, we will have to just face up to the fact that there is illicit trade, and we will rely on our law enforcement work. Our biggest worry is if the products come into Hong Kong, more people will use it, and then a demand will be created. And therefore, more people will be expected to patronize the illicit trade market. As for the effectiveness of publicity and education, well, it is a long-term task. Very often, tobacco companies are not selling them as such in Hong Kong, but they are sending out a strong message that these are modified risk products. And the message has traveled fast to many people. And when we do publicity and education, we want to clarify that, because the evidence we have seen shows that this message is misleading. Well, we just can't stop doing publicity and education. Even if we ban these products, we'll continue to do it. Chairman, I'd like to tell her that there was this organization downstairs who gave us this petition. They said they interviewed over 500 people, and 95% of people said that they objected to a total ban on HNB products. Secondly, 90% of the people thought that after the ban is imposed, they will continue to buy HNB products in the illicit trade market. And number 3, The consequence is 97% of the people were of the view that banning HNB products will not lead HNB product users to quit smoking. And 74% of the people said that banning HNB products will turn HNB product users to conventional tobacco. And number 5, 93% of the people aligning, they agree that you should align the control of conventional tobacco with HNB products. So most people think that you should just regulate it, and it would be better and more effective than having a total ban. This is just for your knowledge. Would you like to respond? Thank you. Well, maybe the 500 odd people were smokers, and we can see that Koch also received over 70,000 signatures supporting a total ban. And also some people who came to the hearing also collected 8,000 signatures supporting a total ban. And the Parent-Teacher Association Federation also recognized a 75% support for a total ban. So the discussion has always been that with regard to people who are smoking or those who use HNB products, they are saying that they would like to have a choice. But then there are more who are worried that young people may take to these products and they may start as non-smokers, and they are worried that young people will be affected. So to the administration, a total ban would send out a very clear message. If we think that something is harmful, it emits secondhand smoke, well, it will have a long-term negative effect. If we allow these products into our market, then what message are we sending out? For those who do not know very much about such products, then they will say that if the administration allows it, then it is just like conventional tobacco. But we have explained that HNB products have many characteristics that are not found with conventional tobacco, so we can hardly regulate it. And it would represent a regressive step in our control of smoking. Mr. Wong Ting Kwong. Chairman, our stances may differ, and it is just normal for us to be citing evidence that support our own stance. But then, as the administration, when you govern society, you should take a comprehensive look at all the information, and at the same time, you should publish macro and all-encompassing policies. You must not be biased. Just now, many colleagues have cited examples. I won't repeat them. I hope the administration will consider them. Let us not talk about health. I think one major conflict is the differentiation between e-cigarettes and HNB products. And the crux of the matter about HNB products is that why do you not ban the use but the import? This will give rise to the illicit market and smuggling. You say the customs will step up their efforts, so on and so forth. But you are actually creating an opportunity for criminal activity. Why do you make a law and then create a loophole? Okay, let me not talk about these serious matters. Let me be more pragmatic. Just now, downstairs, the territory-wide newspaper vendor alliance submitted this paper to us. So let us be pragmatic. Hong Kong newspaper vendors are finding it to survive, as you know. There are many reasons. There are more electronic media organizations than the print media. So newspapers and journals and magazines are reducing in number. They are more expensive as well, so everybody wants to save money, so they use their mobile phone and computers for news. And then we have fewer individual travel visitors, and they are buying, therefore, fewer magazines and books in Hong Kong. So newspaper vendors are really finding it hard to survive. Of course, the Bureau has relaxed the rules, and they are now allowed to sell 12 products. But many of these are found to be impractical for them. And the rules are really strange. For example, they can only sell water, but not soft drinks or other non-alcoholic drinks, not even juice. So they can only sell water. And they can sell ball pens. But how many people will buy a ball pen? And also batteries. Do people buy batteries? You allow them to sell 12 products. But many of them are outdated products.
Therefore, many newspaper vendors find it difficult to earn a living. They said actually the sales of tobacco products really constitute a huge part of their income. It's around 30%. Has the administration considered how to compensate them for their loss? You really should take a comprehensive approach when you consider passing a legislation. Okay, let me go to less serious matters. Well, when you see friends, you pass cigarettes to friends, right? It happens often. Do you see people handing over HNB products? No, because it's actually a very selfish product. You enjoy your own HNB product. It's your own. You wouldn't share out your HNB products with others. So there is a sort of restriction on HNB products. Chairman, no cigarettes you can very easily share with others. And so for HNB products, you really have to consider. You cannot just look into reasons that are beneficial to you. You need to consider all perspectives. You also say that HNB products attract young people and that it's up to around 2.0%. Does that 2% include new smokers, or are they limited to traditional smokers who have changed to the use of HNB products? Do you have any data in this regard? Conventional cigarettes are not very attractive to young people. HNB products, however, seem to be high-tech products. And young people, therefore, are more interested in them. However, if there is education on the side of parents, teachers, and schools, I am sure that there will not be a high number of young people picking up cigarettes or tobacco. Or you think about it, please, or any response from the administration? Well, thank you. We understand what the situation about the newspaper vendors. Will consider it. As to the increase in prevalence of H&B products, I will defer to Dr. Fong. 2.8% of young people are using H&B products, and we see many of them also smoke conventional cigarettes. But I will provide you with the exact numbers after the meeting. You see some people switch between traditional cigarettes and H&B products. You cannot just concentrate on the 2.8%. There are some people who switch to the use of H&B products. You really have to give us specific numbers in all aspects. Thank you. Next, Mr. Ao Nok Kim. Thank you, Chairman. I've never tried a cigarette in my life. Yet I believe that if you are trying to restrict the freedom of people's habits, then this is really a strange phenomenon. Of course, you have to warn people that smoking is hazardous. That is your responsibility. However, the people are from all walks of life. The administration should not force people to change their habits. I don't want to point out who is right or who is wrong here. The educational sector and the medical sector may be concerned with H&B products, but I have always been emphasizing that this should be regulated and not banned. Well, now I'm going to pull myself out of my stance and try to think of a realistic problem you encounter. Are you sure that you can pass this in this legislative year? We have discussed this for such a long time in the past year. I do not see any adjustments in your stance and in your papers. You cannot just say, oh, Mr. Yu Si-wing from the tourism sector asked you about people bringing a part of a H&B device into Hong Kong, and that is worrying. I know that your starting point is not to affect tourists. You may see illicit trade with a ban. However, I don't see that the legislation is protecting tourists. No, you tell us that you are just going to promote it, but I've never heard this. Well, of course, people understand that you cannot bring in drugs, you can bring in endangered species. This is all clearly pointed out. However, our policy differs from other countries' policies, and people may not understand that it is a problem to bring in H&B products. There are different people in society. The administration has not tried to adjust any of its stances, and therefore I don't believe that you'll be able to pass this very smoothly this year. Many bills have already been in line. Look at council meetings as well. There are so many agenda items that are still on the list. I I'm not sure whether we could handle all this before the year is over. We only have like 4 months left now. Are you sure that you'll be able to have this bill passed within this year? Well, if we can't do that, then you've just been wasting your time in the past 2 years. Next year is the legislative council elections. So if you don't have it passed this year, you will have to go through all this again, all from the beginning. You will have to conduct a public consultation all over again. The problem here is not the number of times you conduct public consultation. I'm sure you understand all the support and objection from the public. The tobacco industry and then newspaper vendors are not looking into coming to a consensus somewhere in the middle. Can you try to think of ways to at least be able to achieve something with this bill? Have you considered it at all? DS? Okay, do you have a timetable, and are you afraid that this wouldn't pass within the year? Well, thank you, Chairman. Well, the draft was submitted in February. Well, we know when the next legislative council elections will be. We submitted the draft very early on after the policy address announced it. I can only say that we will try our best to achieve it. Of course, we understand that the decision ultimately lies here. Mr. Ao, let me put in a few words. Thank you for being concerned with how long this will have to wait in line in council. I have to tell you that it's not even passed here at the Bills Committee. Dr. K. Kwok. Well, you asked whether anyone is in support of it. I actually support this bill. We see these new products such as e-cigarettes and HNB products. And we see the largest tobacco player, Philip Morris, talking about 78 billion in profit in these products. So we're talking about they're having around 6 odd billion in profit. I'm sure many of the members here object to your bill. I'm not going to give you the reasons for it. However, the tobacco companies use their best to lobby for these products. Well, I'm also very concerned. How can we ensure that this would not happen in Hong Kong? These tobacco companies show in their annual report that 40% of their product will be put in the development of HNB products and cigarettes. I'm sure you've heard the number of deaths in relation to e-cigarettes and HNB products in Canada. Well, this is a war we need to wage. However, I don't know how we can go about it. I can only say that the government is very weak. The PolyU funding item and the other 2 medical schools funding have been suspended. Mr. Tommy Cheung. Well, point of order. Well, actually, it's not exactly point of order. First of all, he said that the tobacco players are trying to bribe people to support them. This is actually a criminal offense, and it is a very insulting. I don't think you should be insulting people here. You said that people have been taking gifts. Well, I never mentioned the term gifts. I think you should go back and listen to the tape and listen to what Dr. KK Kwok said just now about tobacco companies. I request that you listen to the tape and then make a ruling, because I think that whether he supports it or objects to it, he is actually insulting our members. Mr. Tommy Cheung has raised his concern. Dr. KK Kwok, do you have any clarification? No, I think he's... Well, there is such kind of tobacco lobbying. Well, people lobby around the world all the time. I'm not telling you to just put yourself in those shoes. Oh, yeah, Dr. KK Kwok, do you have any proof, well, to support your claim? Well, I'm not pointing to which specific member, but lobbying. Well, all right. Well, the council chairman has said that what members say in meeting may not be correct. Well, thank you, Chairman. I just want to ask a question. How can the government ensure that the bill be passed under the circumstances? Secondly, you are imposing a ban on trade and not banning the use of these products. Can you also plug the loophole here? Otherwise, there would be a lot of controversy.
Well, before the bill is passed, how can the administration step up regulation at this stage? Because we can see people using these new products all over the streets. Have you taken out prosecution? 3 questions. Can we stop the counter, Mr. Shiu? Dr. Kwok mentioned that in the council or at this bills committee, some members were given benefits by tobacco companies. I think that accusation is criminal. I challenge Dr. Kwok to tell us who he is talking about. Well, if he is just guessing or imagining, then he should let us know, because that is an accusation. He is talking about legislators, and he is pointing at tobacco companies, and this is a criminal offense. So he must come clean, whether he knows this for a fact or he is only guessing. Well, Chairman, as you know, at Legislative Council, we have certain rules. If you declare the receipt of benefits, you are not breaking the law. So Mr. Shiu is asking you the question, do you have evidence? You have nothing to add. Well, no, Chairman. At this Bills Committee, we sometimes can crack a joke, but what he said is criminal. You must give us the facts. I also like to know, Dr. KK Kwok, do you have any evidence? Have you made any report? Well, I have no supplement. If he wants me to make a report, I can do that later. I can now give the floor to the administration. Mr. Tommy Cheung. Well, I don't want to hold him up, but as we are telling the administration, please supply the information in writing. I would also like to ask Dr. KK Kwok whether he has received any benefit and whether he has had any patient from tobacco companies. Okay, please do not digress too much. DS. Thank you, Chair and Mr. Kwok. As to what we have done? Well, I think we are trying our very best to explain. We can see that new information is emerging all the time, especially with regard to evils of e-cigarettes. And also we are referring to new statements by the WHO on HNB products. Last year, in the middle of last year, we talked about regulation, and we did not have that kind of information then because we are facing new products. We'd like to let you know as much new information as we have. And at the beginning, many people said that perhaps the public did not know much about these products, and the administration should step up publicity. We did that. And the Director of Health can say something later. The present situation is basically we do not regulate these products. Even if we see people using them, unless we can test for nicotine when the products are sold, because this is in contravention to CAP 138. Well, we did that and we had very few cases. And also in no smoking zone, whether you use e-cigarettes or HNB products, if we see people use these products in the no smoking zone, we enforce the law. But of course, some people are saying whether we should be doing that. But this is what we'll continue to do. Dr. Kwok asked whether we should ban the use of these products in order to plug the loophole. Well, objectively speaking, if we really do that, well, as some members already said, that we should not be too harsh and push people into a corner. Well, let us be objective. We are worried that if we take that step, in other words, we should ban the use as well. Well, we have already explained that enforcement would be difficult because it would involve body search and search of premises. And therefore, we believe our present proposal is a balanced one. We don't want to demonize people who use these products or disturb them too much. 3 are in the line. The order is Elizabeth Quat, Frankie Yick, Andrew Wen, and myself. You are waiting for a second round, but they are waiting for the first round. If everybody uses 5 minutes, then you have 5 minutes for a second round. Well, if there would not be a second round, I should have told you, but then I have done my calculation and you still have 5 minutes for a second round. Elizabeth Quat, first round. Thank you, Chairman. Many members have spoken their mind this morning. It seems nobody quarrels with the ban of e-cigarettes, but they are arguing the case for HNB products. And I have heard both sides this morning, but my stance remains the same. I support a total ban on e-cigarettes and HNB products. My view is many members say that there is no clear evidence to show that HNB products are harmful, that there are no data saying there is an increase in the smoking population, that people should be free to smoke, and then there would be loopholes in the system, etc. Well, some of these have to be tackled by the administration, but then the major premise is that we know HNB products include nicotine, that it is addictive, and it is going to be harmful to your body, and then there will be a social cost for us to pay. The smokers will also have to pay with their health and life. Now, the major premise remains the same. We can see, well, as the officials said, like in Japan, there is a rise in the prevalence rate amongst young people. I can see online publicity campaigns And also, I can see people around me, including young females, that the tobacco companies are making a full effort in publicizing such products. And all the publicity targets young people. I know many young people who did not smoke, but they think that this is trendy, and therefore they have started using them. And many female friends also did not smoke. They had wanted to use tobacco, but they did not want to have that smell on their body. And now the H&B products are smellless, odorless, so they think that it is safe and okay for them to smoke. Therefore, even if there are no data always lag behind reality. My own observation is such that there are more females and young people using H&B products. I therefore think that this will definitely increase the preference rate in society. Since we have been publicizing that smoking is harmful to health, and if we all support this claim, well, even if members who disagree with the ban would agree that smoking is harmful to health, and now we are dealing with new tobacco products which can harm the health of the next generation because they can become addictive, then why do we want to take the risk? I believe many parents are like me, that they would support a total ban. They would just say that the ban on import but not use will be a loophole. They would like the administration to ban the use as well. And if there is an enforcement problem, the administration should explain to the public. If you say there should be freedom of trade and freedom of smoking, then you do not consider a ban. But I don't think those are good enough reasons. I believe the majority of Hong Kong people will disagree that you want to protect freedom of trade and freedom of smoking and therefore not ban the use of the product. I would rather ask the administration to explain to the public in this period the harm to be done by H&B products and why you also will have a total ban on H&B products. I think the administration's explanation so far is inadequate for some people. And of course, you should continue to lobby members on H&B products. Well, I know that there is no controversy about e-cigarettes. I'd like to remind you that historically, people are still asking why you don't ban conventional tobacco but e-cigarettes and H&B products. Now, of course, when we first had tobacco products, we did not know that there would be such a high social cost to be paid, that people would lose their lives apart from harming their own health. But since we have had this lesson, do we want to track the same path again? If we know that new tobacco products are going to harm the health of the young generation, why do we still allow them to circulate in the market instead of nipping it in the bud? Any response? I'd like to thank Ms. Quat for what she said and for her continuous support for our work. As for the ban on use, well, we do not rule out stepping up our effort later. And as on our work on tobacco, which is conventional, we are still working on it, and we would like to reduce or suppress the prevalence rate to 7.8% by 2025. Next, Frankie Yik. Thank you, Chair. I had been following the meeting upstairs, and quite a few members have questioned the administration for quoting information out of context. Now, I'd like to follow up on a question. In answering Mr. Shill, and Mr. Wong Ting Kwong also followed up just now. you emphasize the South Korean experience, and you seemed to have mentioned the preference rate of H&B products, which is 2.8%, and what you meant was there was a big jump. But what I want to say is you should not only quote figures. Rather, you should look at the total smoking population in South Korea and whether it has risen or fallen in recent years. And also, apart from looking at the overall figures, you should look at the distribution of smokers. How many use tobacco, which is conventional, how many e-cigarettes, how many H&B products. And then you should also analyze the changes in smoking population and what are the social factors there are. You should be more comprehensive. And you should compare those factors with the Hong Kong situation to decide whether indeed South Korea is a good example. You should not just quote the figure 2.8% and say nothing more. So do you have information on what I asked? It's all right if you don't. You can give me a written reply. DS? Any immediate reply? Well, let me explain a little more. We use the 2.8% because a member mentioned that H&B products may not be too attractive to young people, but we could see this comparison in South Korea. Undoubtedly, e-cigarettes entered the market early and there were more data, and we quoted from US, UK, and Canada. In Canada, whether it is e-cigarettes, well, let me talk about e-cigarettes, and then conventional tobacco, there has been a marked increase for both in Canada. In other words, this is not a zero-sum game. But e-cigarettes entered the market first, and we could have the comparison. But we have a difficulty with H&B products because it is relatively new. But we want to be very careful as well.
In Korea, they compared e-cigarettes and H&B products, and they show that there are 59,000 12 to 18 adolescents data. And in Korea, they prohibit the sales of these products to young people. Yet we see that when e-cigarettes were first introduced into the market, about 1% of young people use the e-cigarettes. Well, Chairman, I think that's enough. Well, I don't think you should combine e-cigarettes and H&B products because no one is objecting to the ban of e-cigarettes. We're talking about H&B products. Let me use Seoul or South Korea as an example. So has there been an increase in prevalence in smokers, and what is the ratio of conventional cigarettes, H&B products, and e-cigarettes? Has there been a survey done on the people on why there has been an increase or decrease in smokers? I know more young people are using e-cigarettes because they think it's fun, it's cool, and there are many different flavors. They like to go abroad to buy these different flavors. I'm not talking about e-cigarettes here. I'm talking about H&B products. I hope that you'll be able to answer my question. Well, I think we can provide you with information later on. Thank you. Mr. Andrew Wen, well, thank you. Well, let me first declare that I do not smoke, and I have never been in contact with any tobacco company or their staff. I think that I've only looked at it through logic. Well, this time you see that pro-establishment camp and the democratic camps are both have different views. It's much like what Mr. Ray Chan said about his motions. Well, it's very difficult to try to persuade everyone to come to a consensus here. Well, I myself have my reservations about this bill because I don't think it's very consistent. First of all, many of us object to e-cigarettes. The controversy here is H&B products. The information that members have raised and what is said by the government may not be entirely correct. Something that the toxins emitted are much similar to conventional cigarettes, yet some people say that it's less. And I recently read in a report that Japan has come up with some HNB products with zero nicotine. Therefore, Chairman, it's very difficult for us right now to come to a unanimous agreement. And there's something I really don't understand here. You're banning HNB products. You allow people to use it, yet you do not allow trade. Well, then why do we allow conventional cigarettes? Well, it's just it's just like that you are trying to ban one drug and not the other. How can you really prove that it's better for you to ban HNB products when in truth you do not even ban conventional cigarettes which emit more toxins? I don't mind if you ban all. If you're banning all, then I won't have any qualms about it. I see some new numbers and FDA. Can it really make us believe that it is enough? I don't think so, however, because the numbers I see are not very consistent as well. It's difficult for us to come up to one view or strategy that everyone accepts. I don't think that you are not doing a very good job because Ray Chan's motions have been passed, yet you have not made any adjustments to the bill. Well, I have mentioned my reasons for what I'm saying, but in paragraph 10 of the paper, I see that I'm talking HNB products. There are actually not any data on the highest temperature, and data on these effects are not readily available. Well, you say that there is not enough data, yet you insist that it is toxic. Well, I agree with what Elizabeth Quart said, that yes, smoking is hazardous, but then you cannot be inconsistent and say that yes, it is hazardous, yet we do not have much information on that. I really don't mind, banning all tobacco products, but it needs to be consistent. Oh, it's very difficult for us to explain it to the public as well. It's difficult for us to give a logical explanation. DS, thank you, Chairman. Thank you, Mr. Wen. Let me first refer to what we meant by saying that there is not a lot of data. Well, the data is talking about the exchangeable device, because there has been discussion saying that actually these products are actually manufactured by tobacco companies, and therefore no one is sure of their safety. But these are actually produced by large companies, and therefore there has been data shown, but then we are not sure of whether the data is accurate. We're talking about devices that are sold in the market. You see that for e-cigarettes, there are many different devices, and there are also devices for HNB products that are actually not manufactured by the tobacco companies, and these are actually devices that can be exchanged. Well, we do not know whether these are entirely safe, because, of course, the standards of manufacturing would be different, and that is what we say by we do not have enough data on that. All right, I'm not going to ask a second round. I want to ask about the inconsistency of these policies. DS, we hope, of course, to impose a full ban on tobacco, but then it is almost impossible because there has been a very long history of tobacco products. It it's almost impossible for us to try to lower the smoking prevalence to zero. It's not actually a practical idea. Well, we have already announced in our non-communicable disease strategies, and many of them focus on cancer and chronic diseases. Our smoking rate in Hong Kong is 10%. We hope by 2025 we'll be able to decrease it to 7.8%. And many countries talk about end game, and we also will draw reference from them. So this is actually consistent to what we have been doing. We see that actually tobacco manufacturers want to extend their company lives, and we see that some smokers who used to smoke conventional cigarettes have now changed to ASPs. And so this can help us to achieve the number of 7.8% in a few years, because by then there would perhaps be a lower number. It's therefore to us it is consistent. It may just mean we need a longer time. All right, I don't think there is enough time for a second round. Members, I think you all understand that I'm the chairman on this BC because I was the first to raise the ban of e-cigarettes in 2014. But at that time, there is no such thing as HNB products. At that time, the government was busy doing the medical reform, and so the e-cigarette ban was delayed until last year. As I said earlier, we have missed the golden period of imposing a full ban. We need to consider a practical situation. Colleagues have asked what would happen if we're not able to pass this within the year. Well, we still have almost a year of empty window period. If we are not able to pass this bill, what kind of remedial measures can you come up with during this empty window period? Have you assessed the situation? Secondly, many colleagues after hearing the news of lung diseases in youth by using e-cigarettes, many colleagues actually do not object to the ban of e-cigarettes. Well, are we going to bundle everything together? Could we consider separating e-cigarettes and HNB products? Would that be a more practical method? We can have more time to discuss HNB products. Or would you prefer to just bundle the two up? Thank you, Chairman. Well, there's not much we can do without legislation. We'll not be able to carry out campaigning, promotion, and just focus on the current legislation and to look into our own ordinances that is already in place. Tobacco products are dutiable, and so we can only rely on the current legislation and not to allow smoking in smoke-free areas. There really is not much we can do in terms of control without legislation, and we can only do some sort of promotion to warn people that smoking is hazardous to health. We have been separating the discussion of these two products, although we are actually putting this together on paper for a full ban. There's also another alternative smoking product called the herbal cigarettes, but we really do not know what substances are inside these products. HNB products possess nicotine, and it can become addictive. We are still going to put the same bill on the table, and it will be up to members on how you're going to handle the bill. Well, I'm not giving any stance here when I raised the possibility of actually separating these two products. It's just that I do want something to be done. Well, first I have to say that I need to extend the meeting by 15 minutes because Mr. Ip Kin Yoon just raised his hand, and I can allow a second round. Well, after the public consultation, we heard many views, and we see that educational sector, non-smokers, and parents who are concerned about their children object to or agree to the banning of all products. But then on the other side, users, retailers, manufacturers object to it. Well, for non-smokers, of course, they do not hope to be in contact with any such products. But for those that are in the habit of smoking, then they are happy to have one more option and to reduce the impact it has on their family members.
而家目前
But then, up to this moment, the administration has no data to do a meaningful comparison. Say, for example, if someone is a smoker, if he goes for conventional tobacco and HNB products, and if he requires the same nicotine level, then what would be the other substances, toxic or otherwise, that he will be taking in from the two products? And as the member also said, if the tobacco company will make a huge profit from the sale of HNB products, then what would be the publicity amount like, so that there will be many more people attracted to it? Do you have a model to do that kind of estimation? I don't think you have. But if you can't do the comparison, then we won't know what harm will result and which will do the bigger harm if people remain conventional smokers or smokers of new products. I'd like to make that point. Well, I don't think I need any response. Mr. Ip Kin Yoon. Thank you, Chair. I'd like to register my stance first. I'm of the view that we should ban both. In the long term, we should even ban conventional tobacco. But of course, there are historical factors. We have a long history of using conventional tobacco. If we ask all smokers to stop smoking right away, it will be so difficult. Well, one important matter is that there is consensus with regard to e-cigarettes. Because it's so tempting to new smokers. So we've got a consensus there. So our attention is turned to other ASPs, including HNB products. Would that give rise to newcomers to the smoking population? I think that is what we have to consider. I believe the DS was clear that she is of the view that there will be new smokers. But can you give us evidence? Because I think it's going to help our discussion. But since HNB products have a short history, well, I think as the Bills Committee continues its work, I'm sure new data will emerge. Actually, in the last half year, we have had so much new information surfacing. I hope the Bureau can dig up all such information for our knowledge. If HNB products do give rise to new smokers who become addictive, then it is a big threat to public health. Some people say that HNB products can actually be a way for quitting tobacco. But if it is a gateway for conventional tobacco, then, and if that is proved, then I believe it is most important for you to supply that kind of information. You must be more compelling in giving us the information, and I think that would be helping our discussion a lot. DS? Well, about quitting smoking, Dr. Fung? Mr. Ip asked whether HNB products will attract new people to the smoking population. We are now proposing a ban because we don't want to have newcomers to the smoking population. But there is another major reason, and that is we don't want smokers who want to quit to change over to this product thinking that it does them less harm. This is actually a very important reason why we don't want to introduce new tobacco products into the market. All over the world, the smoking trend is such that it is all going down. A total ban can help us suppress the smoking population continuously. And that is why the companies are devoted to developing modified risk products because they want to attract new people to smoke. So importantly, we should allow smokers who want to quit to be able to quit instead of going for a so-called less harm product. I'd like the opportunity to answer Mr. Shill, saying that the WHO report also says that there are toxic substances that are released. Now, I'd like also to say that in our paper, we say that the FDA also says that the release of certain toxic substances is lower from HNB products. But does it mean that we are less in touch with toxic substances? Well, the premise must be that you should change over to HNB products 100%. But practically, if we look at the actual usage, we will see that many people are dual smokers, meaning they use conventional tobacco and HNB products at the same time. Therefore, even if there are HNB products, will smokers be in touch with fewer toxic substances? Because we can't see that happening right now. Okay. We still have a little time left. We have Shiu Kao-fai and Andrew Wen, 3 minutes each. Mr. Shiu, thank you. I'd like to respond to the doctor. She said, if we use HNB products, it doesn't mean you don't use conventional tobacco. So even if the toxic substances are less in HNB products, we still don't know about any significant data. What is the logic of this all? I can't follow your logic at all. Chairman, what she is saying is that she agrees that HNB products are less harmful. It's just that if you use conventional tobacco at the same time, Mr. Shiu, well, I have written down the government's stance. If you smoke, they only propose that you should quit and not make other choices. Well, I know, but I'm talking about the logic. If she is of the view that HNB products are less harmful, then if people choose such products, but at the same time also use conventional tobacco, then they should be exposed to less harm. And in fact, I know many people switch over to HNB products 100%. I don't smoke, but I see many people around me smoke. When people have switched to HNB products, they hate conventional tobacco because they think it is smelly. And the Koch report, you say 75,000 people support a total ban. But first of all, again, you are bundling them up. And secondly, please go to the Koch website. The figure is 53,400. Why do you say 75,000? You are cooking up the figures. Number 3, last time at the hearing, well, only 10% of the population smoke, but there are more supporting regulation than a ban. 50% agree to have regulation, 42% agree to a total ban. And at the hearing, 54% agreed to regulation and 46% agreed to a total ban. Therefore, from the figures, it is not 9-1. If you tell the public, they will understand and people can make their own choices. But if you only talk about health risks, you have also to be comprehensive and not quote things out of context. Well, we have not been reading all the papers, perhaps at panels and other committees, but at this committee I have read everything. Any response? Also, well, I think the main thing is the misquote of figures. Well, I don't need any response. In 2016, in New Zealand, it talked about a total ban, but it has relaxed it. HNB products are allowed. Just go to the New Zealand government website. They say it is better to use HNB products. Any response? Well, I will check the figure, because actually I asked my colleague for the latest figure this morning. Last 3 minutes, Andrew Wan. A very short one, I don't need a reply. Mr. Shiu. First, the government's logic is just to quote overseas experience that serves them well. People of different political stances know that very well. I think the chairman made a very good proposal. Please do not bundle everything up. It is not that we object to you totally. It seems we only have an argument over HNB products. So why don't you consider the chairman's view, and that is to take it out from the bill. And after this social turmoil, I don't know why the administration still stands firm in the case of huge controversy. I believe you should adopt a better attitude and make the right choice. And I believe then China and Hong Kong will have a better future. I think data are important. We are all only talking about estimation and projections. People who use non-conventional tobacco and you say these can act as a gateway and eventually use conventional tobacco, but then it's not true. Some people don't like the smell of conventional tobacco, and some people actually never consider conventional tobacco. They may go for new products because of the less harm. And in fact, your figures are not clear either. You always emphasize that there is an increase in number of users in ASPs, but you do not have any subdivision. What about the proportion of conventional smokers who go for HMB products? Now you are giving us a blank. Different political parties are asking for the same information. So how do you expect us to make a decision? Just now there was a view that you say you want to nip it in the bud because you don't want young children to be attracted to it. But I think the same can be said about conventional tobacco. Some emphasize that they were light, trendy, particularly made for women. Why did you not hit out on them? I think your logic is flawed. I don't think you can coordinate all the points you are trying to make. And I don't think you can convince members here. Any response? What about figures? We'll go back and organize again because the papers may be long and figures might have appeared at different parts. We will go back and do some organization. Well, I think they have a firm stance, and so that is why they are using the figures that way. But no matter what, we care a lot about public health. And of course, we want to suppress the smoker data, and we don't want the figures to go up. But actually at the hearing, we heard some people say that their family don't find smoking that disturbing and find it more accepting after they have changed to new products. The meeting is adjourned here.
未來嗱，答到你，
I can't answer your question now.
暫時都係
We still need to see whether there's an opportunity to deal with it, because right now, from what I see, we are still not able to go to the clause-by-clause scrutiny, so there is still some time. Tommy Chung said he's going to move a CSA. We'll also need to explore that. Well, Chairman. Well, I'm not know about the procedures. Well, I sat through a 3-week public consultation in April. Well, I have seen your feedback, but I didn't think that we should extend it to a minute, perhaps once a month. I don't object to a CSA, but can we just bring up a CSA at any time? Well, I think it happens after the clause-by-clause scrutiny, but then we'll see whether he will introduce the CSA to us. If you all think it all right, then perhaps it would be even more smooth. Thank you. I adjourn the meeting.